Hi, my name is Elise Kiuna, and this is my presentation entitled My Future MP Self. First of all, I'd like to take an opportunity to thank you for letting me re-record this. I do apologize for the technical difficulties, but this is my presentation. So first off, I'd like to talk about a little bit about nursing leadership, kind of past and present, where we've been and where we're hopefully headed as a profession. The nursing profession as a whole has always kind of demonstrated a certain air of leadership, of course. However, the theory behind leadership, especially in the advanced practice registered nurse setting or the APRN setting, has evolved significantly. What was once a kind of a scientific management perspective focused on employer employee model driven by rules, regulations, policies, procedures, is now being replaced with a model that emphasizes transformational leadership. The present emphasis on nursing leadership embraces the dynamic and organic nature of complex adaptive systems, which is nice because it's a nice direction to go. For our purposes, we'll be analyzing the following types of APRN leadership: clinical, professional, systems, and healthy policy promotion. To be a transformational APRN leader, we must touch all four of these realms. So first off, let's kind of define what is a transformational leader. It's one who constantly not only asks their team, but asks themselves what the goal is constantly, how to try and do things differently, and what are the costs of maintaining the status quo. This form of leadership that transformed the team by leading to change different values and attitudes, perceptions, and or behaviors on the part of the leader. It lays down the groundwork for future and further positive changes. And then this form of leadership inspires higher levels of motivation and morality among participants. All right, our first form of leadership is clinical. So, clinical care is the most recognized area of leadership for APRNs. Numerous studies understand the vital role for APRNs play, and it has been proven time and time again that they are effective, promote quality and safety in all healthcare settings. This form of leadership focuses on the needs and goals of the patient and family and ensures that quality patient care is achieved. It's a foundation for attaining and maintaining a productive environment in which safe and excellent care is being practiced. The hallmark of this leadership occurs when APRNs acquire and apply knowledge about how to build appropriate working relationships with healthcare team members. When they also instill confidence in patients and colleagues and problem solving collaboration with the team as a whole. They propose, implement, and advocate for change strategies to improve patient care and ensure the best clinical outcome that can be achieved. Next one is our professional leadership. So, organizations such as the American Nurses Association or the ANA define the standards for registered nurses and describe the competencies that practitioners should perform. Active participation in these types of organizations is a very important role as they provide a myriad of leadership opportunities, including organizing continuing education offerings, presenting at national conferences, chairing committees, running for the boards of directors, and things like that. Professional nursing usually begins at a local level and can proceed to state, national, and even international levels to influence organizational change. Professional leadership can be very influential in developing styles, strengths, and networking as APRN leaders. So, when these types of leadership roles are taken, it creates necessary credibility and visibility for APRNs in our positions that we stand for. Next, systems leadership. So, systems leadership means leading at the organizational or delivery system level, a skill that requires a multidimensional understanding of systems. System leadership often requires a quote unquote kind of big picture view and understanding the elements of care delivery far beyond nursing. It's kind of like the whole picture, all the different nooks and crannies, and all the wheels and cogs of things. There's a working understanding of the healthcare system and all of its components or moving parts. So since there's widespread understanding of quote unquote how things work, the APRN can identify internal and external issues to find solutions that transcend the various levels within the systems. So it's the form of leadership that with this form of leadership, it's important to contribute to the development, into implementation, and monitoring of organizational and system performance standards and enhance group dynamics while maintaining conflicts. Last is health policy. Health policy and advocacy is an area where more leadership for nurses is actually necessary because less emphasis and development has been dedicated to this area. To lead in policy and advocacy, the APRN must fully engage with the issues. They must also articulate the value of nursing to key stakeholders and policymakers. It's been explained that APRNs are a unique position to take a leadership role to shape healthcare reform because they use extended and expanded skills and are trained to focus on improved patient outcomes. The application of evidence-based practice and assessing cost effectiveness of care. The intuitive nature of nursing drives desire to make positive changes that will impact our patients with the greatest impact. Policy changes instill massive impact. So this is me. As you can tell, I'm a little silly. I believe that when we let our guards down and we are a little silly, we actually make ourselves more personable to people because they feel like they can approach us. And when people feel like they can approach you, I feel like you are able to reach them and therefore be a good, successful leader. So the various questions that we were charged with in the setting of we have graduated from our program, we are going to be a leader, and we need to ask ourselves some of these questions. The first being, describe the type of leader you are. I am a very all for one and one for all for one, and one for all and all for one type of leader. I know that might sound a little greedy, but it's not. It's the meaning behind this idea is that each individual should act for the benefit of the group. And on the reverse, the group should act for the benefit of each individual. We all possess strengths and weaknesses, and my style of leadership is to motivate each member of my team to harness their personal strengths and qualities for the good of the group. So ultimately, the group can best work for each individual. The next was tell us an example of how you demonstrated that style of leadership. Well, a couple years ago, I once led an initiative to educate my entire unit of nitrous oxide, I once led an initiative to educate my entire unit on nitrous oxide apparatuses and safe administration. We were using these new systems in the labor ward. And I was also in charge of writing policy, helping with that and conducting unit-wide training and competency checkoffs. I made sure to push the idea of being fluent on every individual because if you do that on an individual level, it would in return help the entire group since every member of the unit would in a sense be a subject matter expert and resource. So this constant level of competency, it instills quality level patient care and safety for the entire group, which is my ultimate goal. How will you use your unique leadership style in our practice? These are some wonderful nurses I once worked with. And let's see. So how will you use your unique leadership style in our practice? So the basic foundation of my style of leadership is teamwork and promoting the success of the group on a micro and a macro level. Ensuring that every team member is aware of their strengths and weaknesses allows them to play them for the benefit of the group. Because if the group succeeds as a whole, so do all of its individuals. Like I said, all for one and one for all. Next question, how will you mentor and empower others? So the APRN mentor creates a safety net in which the protege can expose vulnerabilities and be coached to develop confidence in new skills. Team members need a leader to demonstrate active and reflective listening. At the root of it, people just want to be heard and understood. This sense of acceptance and the exposing of vulnerabilities allows team members to flourish with their strengths and become empowered. Um, if you empower your team members, they will empower each other, and like I said, empower the group has in return. Next question: how will you maintain the competency to lead others? Healthcare systems are constantly changing. And in order to stay afloat of constant change, it's imperative to always be aware of how your team is doing. Constant maintenance of every individual of a team is difficult, but it's necessary. It's quite necessary to ensure that one succeeds. It's this success for everyone that depends on the individual succeeding, in my opinion. Being a figurehead that promotes group morale and unity is how you maintain competency as a leader. A competent leader also knows when to provide help when part of the group is faltering. So this is a wonderful group of nurses that I once worked with, and had the pleasure of being a team leader in some instances and charge nurse. These are my references. And once again, thank you. Have a wonderful day.